Okay, medical uses. This is a tiny, tiny little list. I don't know how many of you saw the Insight program run by Jenny Brocky a few months ago when they were actually covering the idea of medical cannabis. But she objected to my suggestion that there probably wasn't a significant human health condition on Earth that wasn't in some ways responsive to cannabis therapy. And she objected on the basis that nothing can be that good. But if the underlying disease processes all result from a dysfunction of the regulatory system, the endocannabinoid system, you can have one medication that can affect a whole range of very, very unrelated conditions. I mean, you might ask, what does paediatric epilepsy and Crohn's disease have in common, apart from the fact that they both respond dramatically to CBD-dominant cannabis? My attitude in science is you look for the effect first and the explanation second. You don't put the cart before the horse. Okay, thanks, Sis. All right, the big question, and what everyone wants to know, does cannabis cure cancer? Now, at this stage, to use a hackneyed phrase, the jury is still out. This is my experiences so far. About 2 years ago, I was confronted by a lady who I'd been providing some sort of, I suppose you'd call it naturopathic healthcare, dietary healthcare, during a 16-year battle with breast cancer. And we'd kept her going quite a while just with dietary strategies and things like that. But it got out of hand, and the cancer actually invaded into her arm, into her brachial plexus, which is the big nerve that governs the arm. And not only was the arm paralysed, but she was faced with intolerable neuropathic pain. Neuropathic pain is a pain derived from damaged nerves. And she and her family arrived on my doorstep on one Sunday morning, everyone in tears, mum sort of, thrashing around in pain, saying the doctor said she's going to die, what can you do? At that stage, Rick Simpson oil wasn't very much used. This was a few years ago now, and that packet of pound that I showed you was what we went and got for her. And I made up the Rick Simpson oil using we used the hexane extraction then. And because of the desperate nature of the situation, I really dosed her immoderately, I'd have to say. It was very, very, very heavy dosing. And she spent 18 to 20 hours unconscious on a couch. But within 10 days, the pain in the arm had stopped, and over the next few weeks, she regained function of her arm. Right? Now, I thought, my word, it's all over. We've got the answer. And I went on to treat 5 more patients in the same way, and none of them responded, right? So we're nowhere near at the end of it. And what I've come to appreciate is health and disease is a very complex interaction between the environment, the individual, their conditioning, and the therapeutic options that are aware to them. And it's very hard to make generalisations about anyone. Now, there is no doubt whatsoever that there's huge indicators of efficacy or indicators of positive action of cannabis against cancer, right? It's done, the models that have been investigated, we use either tissue culture, where you actually get the cancer cells growing in a petri dish, or you inject those cancer cells into an immune deficient animal, and then you develop a human cancer on a mouse or whatever other animal you care to do. And in those tissue culture and animal models, various forms of cannabis have demonstrated dramatic anti-cancer effects. Now, unlike chemotherapy, when chemotherapy drugs, like cytotoxic drugs, and remember, most people aren't aware, who knows where chemotherapy got its start from? Is anyone aware? No, gas attacks from the First World War, right? The Germans threw some mustard gas at the British, and the British surgeons noticed that the bone marrow had been wiped out and said, why don't we give this to leukemic patients? Which they did. And admittedly, it had a good effect for the first couple of weeks. But then because of the destruction of the immune system, they went on to relapse and die. But yeah, chemotherapy has grown out of gas warfare from the First World War. So it's not a very salubrious way to actually develop a therapeutic. Now, I really do want to stress that first thing. Does cannabis cure cancer? There is always the primacy of prevention over treatment, right? If you want to cure cancer, don't get it in the first place. Now, I know that's a glib thing to say, and there's different types of cancer. There's the cancers that are unequivocally associated with lifestyle, right? The small cell lung cancer associated with smoking, the thyroid cancer associated with radiation exposure. You know, there's some, even the breast cancer to a point associated with being overweight and having a high animal fat intake in your diet and things like that. There's clear things. There's other tumours, especially in 3-year-olds or others, that have no clear environmental trigger, and you don't know what's actually going on. There's a lot of possibilities. The doctors at this stage are saying, we don't know why you've got cancer, and they seem to abrogate the individual responsibility. What is cancer? As you all know, cancer is the uncontrolled growth of cells and the lack of what they call contact inhibition. Normally when cells grow, once they start touching each other, they stop growing. That's contact inhibition. Cancer doesn't have contact inhibition, and it just goes on and on like that. Now, the biology of cancer is not very well understood, and there's a lot of misconceptions, which has led to some strange treatments. The first one is that cancer is monoclonal. That means it's got one cell type that's gone bad. When you start to look at the cancers more carefully, it's clearly polyclonal. That means you're dealing with more than one cell line. So often when you receive treatment with radiation or chemotherapy or some other form of therapy, it can work very effectively against one of the clones, but not against the others. So the usual pattern of having chemotherapeutic treatment is you'd normally get an excellent response. You've got big lumps coming out of your body, and doc gives you the weed killer into your arm, and the things go away and say, oh, look, mum's tumour's getting smaller. That's what happens. Normally, in the first untreated cancer, something like 90% of the cells are sensitive to whatever treatment you give them. But what's left? The ones that are left, the 10%, are now resistant. And if you've been irradiated, it's worse than that. The radiation actually develops what they call resistant cancer stem cells. And they go on to repopulate the recurrence or the relapse with resistant cells. So the next dose of treatment that you give has to be much more toxic in much higher levels to even get the same result. And the result of treating with chemotherapy or radiation is the bouncing ball effect. The first result, the ball bounces nice and high. The second one, it bounces about half, and then about a quarter, and then barely at all. And that's the response of chemotherapy. It's really, with very few exceptions, and those exceptions would be testicular cancer and Hodgkin's lymphoma, which appear to have long-term responses. By that I mean more than 10 years. Most of the chemotherapy is an evanescent effect, right? That means it works for a while, but then it ceases to be effective. In just the same way as we've overused antibiotics, and now we have a whole suite of resistant germs that don't respond to the antibiotics, in the same way with the cancer, after they've been exposed to an agent or two, they develop resistance. It's not a static thing. It's an adaptive, infiltrating sort of entity that learns from what you do to it and takes efforts to evade both your immune system and the chemicals and the radiations that's thrown at it. So, hang on, models of cancer, clinical case reports. There are a couple of well-documented case reports of dramatic responses to cancer. Probably one that should have got a lot more attention than it did was in the Johns Hopkins Hospital. This is on the internet. A 14-year-old boy had what they call a Philadelphia positive, chromosome positive acute lymphoblastic leukemia, which is a particularly nasty hematological malignancy, right? And this kid was in Johns Hopkins University Hospital, where they treat like what we call cavalier treatment. He was receiving enormous doses of chemotherapy. Anything they had, they were giving to him in series. Now, your white cells should be below about 11,000. His white cells were 300,000, right? So it gives you an idea of the extent of his disease. And with all the chemotherapy, the leukemic cell index was going up on treatment, and that's a real, what we call a negative prognostic indicator. It usually means there's no hope at all. Now, the family as is often the case in these dying times, said, we really want to try cannabis. And after the usual sort of foot dragging and things like that, they decided that, yeah, the kid was obviously dying, so what harm was there? And they gave him some cannabis oil for a week, and there was very little change in his state. And then they changed to a different oil, and over the next 5 days, there was a daily and major stepwise reduction, right? He'd experienced a major tumour response. Unfortunately, on the 5th day, he died as a result of a hemorrhage which had been induced by the prior chemotherapy. Now, as a measure of how scientifically corrupt the people are at the Johns Hopkins, they didn't analyse the cannabis oil, the second cannabis oil. Now, to me, that's tantamount to, I mean, it's a crime against humanity, because it's clear now there are different combinations of cannabinoids that have more or less effect. Some oils do some good and some oils don't. And at this stage, we can't know what. But at that particular individual case, we had a chance to look at the differences between a non-effective and an effective treatment, and that's been lost for all eternity. Now, you just look at the science of the people that are opposers. Here someone said, oh yeah, we got a response to cannabis. I said, well, what was in it? What was it? It's like saying we got a response to tablets, right? It's just pathetic that scientists can behave in this way. It's just the same say, oh, cannabis does this or that. It really does depend, and we have to get a lot more subtle and a lot more detailed in the way we actually view medical cannabis, because there's very, very significant differences. Now, the difference between a tumour response to cannabis and a tumour response to chemotherapy is massive. When you give someone chemotherapy, the cells that are affected die by the process of necrosis. Necrosis simply means death, because the cells swell up and burst, and it's quite a messy and inflammatory condition. When cells interact with cannabinoids, they don't go through necrosis. They go, actually, we'll have the next slide, I think. They go through a process called apoptosis or autophagy. And these are basically physiological processes. So when you're a little embryo in utero, remember your hands start off as a little blob, and then by the process of apoptosis, they're actually remodeled. The extra skin is cut away. So the apoptosis is, they call it cell suicide. You can say that, but what it is, it's an energy-dependent process where the cell actually pumps out its own fluid. It's a bit like you sort of open a tap and squeeze out all the fluid, and the cell goes from this size to this size, and then it's just taken up by immune cells and recycled. The beauty of it is it involves no inflammation. It's a very tidy process, and it completely leaves alone normally transformed cells. So if you have, say, 50% cancer cells, 50% fibroblasts in a petri dish, and you put the cannabinoids in, you'll delete the cancer cells without affecting transformed cells, like normal cells. And that's a huge difference between that and most of the chemotherapeutic agents. The other important effect of cannabis is the inhibition of angiogenesis. Angiogenesis just means the development of new blood supply, right? When you've got a tiny tumour, less than a couple of millimetres, it doesn't need a blood supply because all the nutrients can infuse into it. But to get bigger, to get more than a couple of centimetres, it has to make blood vessels grow. And if you can stop the blood vessels from growing, you can choke off the tumour or slow up its growth. Now, the allopathic doctors are developing various antibody things aimed at attacking the angiogenesis factors, but they haven't had a good clinical response. With cannabis, it appears to be, let me try and make this balanced. In all the patients we've treated, we've only seen a couple of dramatic remissions, right? But in many of them, we've seen a significant slowing of the disease. And so many times the doctors said, I've got 3 months to live, and 2 years later they're still coming to see us for their oil and things like that. There is no doubt cannabis slows up the growth of tumour, whether it's a direct effect on the tumour itself or by enhancing the person's well-being and recruiting their immune system against it. It may be both. The other thing is increased intracellular adhesion. Now, the cells in our body, all the cells in our body are joined by these little things called desmosomes, and they stick the cells together. But with age and junk food and all the other things, the gaps between our cells get loose, and it makes it relatively easy for metastases to take root. With the cannabis, it has a clear effect of increasing intracellular adhesion, and it basically shoulders the mets out. So these are effects we've seen, the slowing of the rate of metastases and the growth of the tumours. And our mission at the moment is to refine our therapeutics to actually increase the rates of actual remission that we get. Okay, why are we not getting better results than we're getting in the field of cancer treatment? My particular bias is that most of the people that come to us, firstly, they're usually coming at the end of 3 or 4 cycles of chemo and a bit of radiation, and they're suffering from severe long-term hyponutrition with multiple significant deficiencies, specifically omega-3, iodine, zinc and selenium, and many others. Now, I'll talk about those because they're all important. I'll come back to that. The other thing, and probably the main stumbling block to people's wellness, is that they're prisoners to their own habits. And those habits can be habits of behaviour or habits of thought. There's nothing more corrosive to the human psyche than negative thoughts, whether they're coming from outside, but more specifically if they're coming from inside. And when you actually use kinesiology to test people to see what their belief and whether they get better or not, a lot of people are plagued by fear and doubts about their outcomes, and that almost guarantees a negative outcome. Now, I know it's hard to keep a positive outlook when you're confronted by a malignant growth, but what else can you do? Okay, especially radiation generates these resistant cancer stem cells, and in many cases they make the treatment almost guaranteed to fail. The problem with radiation, as in the problem with chemo, is you do get an initial good effect, and from time to time, very regrettably, we've had to send some of our less successful patients along for focused radiation to control things like particularly painful bony mets or a situation where it might be critical on their nervous system or something like that. But normally by the time we've done that, we've accepted the fact that we're not going to have a cure and we're into holding mode. But radiation, short-term gain, but long-term pain by a long way. With the chemotherapy, it not only affects the tumour, it affects every cell in your body, and that's witnessed by the fact that your hair falls out, your gut passes blood and all the rest of it, you're infertile. But from a cancer fighting point of view, if you don't have a highly honed digestive system and a very effective immune system, you're really not going to win. And that's why chemotherapy can't win, because it doesn't recognise the fact that the cancer and the human host, the reluctant human host, is in a relationship with each other, and you can't treat one without looking at the factors in the other, and it's without a digestive system to nourish the body and an immune system to delete the cancers, your treatments are only going to be of limited effectiveness at the best of times. Some tumours appear to lack receptors, CB1 and CB2 receptors. Now, very little work has been done on that, but the way I see things going forward is that once someone has a tumour biopsy, in the future, I'd like to think we'll do CB1 and CB2 assays on them at that stage and direct the people with high density of receptors straight to us, rather than let them go through a whole lot of other treatments before they come to us at a stage when it's where it's likely to be less effective. Now, the big question there is it only via the CB1 and 2 receptors that the cannabis has its effect? And the answer is a resounding no. It seems to have 3 different effects, right? Operating on the receptor is the first one, and that appears to maturate the cell. It'll either cause it to commit suicide, or it'll make it go back to a more normal cell. The fact that cancer can be cured by cannabis is very well illustrated by our treatment of basal cell carcinomas. Basal cell, or BCCs, are a very common form of skin cancer. We started experimenting with BCCs because even though they can be very destructive and grow very large, they don't metastasize. So we're not going to put people at risk. For instance, I wouldn't use cannabis treatment topically on a melanoma. I don't think that's wise at this stage. Even though it may influence the surface ones, it's probably, in my mind at this stage, the melanomas are much better dealt with by primary surgical excision, hopefully in an expert unit. Because melanomas are different than a lot of cancers. Once they get to a certain depth, they will metastasize, and the metastases are difficult to deal with. So unlike some people that slather them with black salve and a whole lot of other potents and unguents, I really take a great deal of care and respect with melanomas. With BCCs, we don't have to, because we know if we fail and they get out of control, you can always go back to a surgeon and have it grafted if necessary. But that hasn't been necessary, and the way it's worked for us, it's gone the other way. We're getting the people that the surgeons have rejected. And we've got a famous case that we treated early this year. The lady came in and she had a hideous BCC. She was about 70, a country girl, had been there for years. I've been meaning to get something done about this. But by the time she finally went to see a surgeon, he looked at her and said, "Christ, lady, we're going to have to amputate your nose." Right? It's a big thing, especially if you're wearing glasses, mate. You try it without. But yeah, it's a hideous deformity. And she said, "Well, what can you do?" And I said, "Look, give us a month, see how we go." And long story short, yeah, she got better. Right? It's funny. Yeah, but wait, you go back to the doctors. It's not me, mate, it's a herb, right? Don't forget that. Anyone can put the herb on. She went back to the doctors. They don't want to know about it. I had one patient, she had breast cancer. Admittedly, it was only an early stage. We got a needle biopsy on it. It was an early stage breast cancer with no nodes. And so we went on, and we didn't even use cannabis in her, just an intensive nutritional weight loss program. 6 months later, she went back to the surgeon, had the repeat ultrasound, a repeat examination, and the husband looked and he says, "There's no cancer." And the husband said, would you like to know what we've done? He says, "I've got no interest." He said, "You can go now." Right? This is a sort of closed-mindedness that is leading to the situation we're in, an ideologically rather than scientifically driven medical system. Okay, the next thing is a poor quality and quantity of herb. And that's sad. I mean, we're all aware that there is a undercurrent of rip-offs going on in the pseudo-medical industry. There is, and I recognise, a growing army of compassionate people that are risking their own life and freedom to produce medicine for people. I don't think they need a pat on the back. I think it's just a self-obvious thing to do. But there are others that don't. And sick and vulnerable people are being ripped off, both by the fact that the black market prices and the fact that people are making medical preparations of very poor quality. And that's certainly responsible for some of the failures. Okay, the politics of cannabis. Now, does anyone recognise what that is? That's an American herbicide plane flying Agent Orange over Vietnam. Now remember, does everyone know what this is all about? Back in the 60s, the Viet Cong were basically winning the guerrilla war because they could go and hide in the jungle, and they used the Ho Chi Minh Trail to sort of bring supplies in from the north. The Americans' way around that, I think they dumped something like 23 million litres of this Agent Orange herbicide on the jungles and deforested a huge amount of the country. Now, the politics of these people, I think it was made by Dow or Monsanto, I'm not sure. They took shortcuts in the manufacture of this material, the II.part and the II.4d, and heavily contaminated it with dioxin. Dioxin is the most potent chemical carcinogen known to man. Right? Literally a cupful could wipe out Australian population if it was distributed that way. It's bizarre in its longevity and its potency to cause disease. Worse than that, dioxin causes diseases in the germline. There's a difference between a process that causes a disease in the subject, but this one causes a disease in the subject's children and those children's children. So we're seeing Agent Orange victims now, 3 generations post-exposure, right? There's 5 million Vietnamese children affected by this now. This is the politics of the people that gave you the prohibition. We're dealing with sociopaths, right? It's no point in calling it anything else. I say we live in a pharmaco-fascist society. They've used drug policy to control the people, and it's very much a case in the health system of the fox minding the pigeons. I feel there is unequivocal evidence that they have consciously degraded the food supply and made us vulnerable to cancer, and then peddling snake oil cures at us in the form of chemotherapy and radiation. No. Listen, I've mentioned snake oil cures. The irony, as it turns out, the original snake oil salesman used to peddle an extract of the Chinese water snake, and it turned out to be 20% omega-3. So it's likely that the snake oil salesman did a lot more good than Eli Lilly and Roche and all the other buggers in their suits. Okay, politics are a big thing though. Now we're seeing a breakdown of the prohibition. There's no doubt there's cracks in the edifice. It happens that we live in one of the right-wing countries, right-wing by default. Unfortunately, Australia's become an iron fist with a velvet glove. So it looks like a relaxed, laid-back thing, a bit of a nanny state. In fact, it's a pharmaco-fascist state. And we're seeing worrying signs. The rollout of the Draeger saliva machines is a bizarre backward step in this country, because I think the right-wing forces are actually using saliva testing as a way of controlling things, even if they lose the battle about medical and recreational cannabis. They say, yeah, you can have your medicine, mate, but we'll catch you on the street and we'll take your driver's licence away. The only way around that, we have to, and we must become more vocal in our opposition to the saliva test for a number of reasons. The first reason is they don't contribute to traffic safety. And the only reason for doing these things is for traffic safety. The only type of test that influences traffic safety are impairment-based tests. And the old thing of drawing the chalk line and getting you to walk along it is a better test than a saliva test. The saliva tests that are used in Australia were tested in Europe and discounted and discontinued on the basis that they were unreliable. They gave too many false positives. That means they showed up positive when you should not have been positive. And they're a major incursion against a person's right to move about. By testing just the saliva, and usually for cannabis, and remember they don't test for pharmaceutical drugs like benzodiazepines, like Valium, or like antihistamines, or like the sleeping tablets, which are very clearly represented in fatal traffic accidents. Right? So we're completely off the track. And now is a time, before these things become entrenched, to make a lot of noise and organise resistance against this, or we'll find ourselves in a situation where we win the battle and lose the war. Okay, it really is something that I worry a lot about. Okay, models for progress. Now, I repeat my assertion that the prohibition is problem, not the plant. And once that is borne in mind, there is no point in just letting the door open a little bit, right? The basic underlying assumption in the government is, oh, it's still a dangerous plant, you'll still get psychosis, but looks like some of it helps medically. That's not the way it is. Cannabis, in all its forms, is the safest therapeutically active substance known to mankind. I can say that without fear of contradiction, both in terms of its LD50, and I'll explain that to you so you can involve yourself in arguments with others. LD50 stands for the lethal dose that'll kill half the population exposed to it. Right? With alcohol, say you have the normal social intake of alcohol might be 5 drinks, say that's 50 grams of alcohol. If you have 3 times that or 4 times that, you're at significant risk of dying. So the LD50 is 4, a relatively modest number. With something like water, if 2 litres is your intake and you have 20, you may die of brain swelling. So its LD50 is 10. And it goes like that. Most drugs are in those small numbers. Cannabis has an estimated LD50 of 40,000. Right? There is nothing like that. Table salt is probably down to about 50. Right? So are you getting the idea? It really is in a class of its own. And that's why I feel completely relaxed in advocating a 3-tier system of supply. The Baird government and all the other right-wing half-wits that are forming governments around this country are getting their knickers in a knot over supply. Oh, where's the drug going to come from? Because of its overwhelming safety and its complete freedom from organ toxicity, I feel that the basic starting point of a medical cannabis regime is a removal of the prohibition. Humans can sort themselves out. They don't need a nanny state, which has done nothing but peddle lies and confusion on the subject since 1937 and before. Home growing, don't worry about that. Home growing has several really major advantages. Firstly, and primarily, it's a basic human right not to be told by the state what you can and can't ingest. Right? The only place the state has that right to intervene is where that impacts on other people. Things like drink driving, I'm very much in favour of breath testing, because there is a clear and unequivocal association between alcohol use and a dose response and traffic outcomes. It's clear in Colorado, after a full medical cannabis regime of only 12 months, there was a measurable decrease in fatal traffic accidents, in suicides and in domestic violence. Right? They're being very quiet about that. A measurable decrease in all of those things. So they can't use the idea of traffic safety to justify their saliva test when they're not actually testing for benzos or any of the other sedating allopathic drugs. It is a worry. Proxy growing, large and small scale, this is our second tier, where people like us, like the Nimbin people, like everyone who's been involved for the last few years, can take on a number of patients. They might have a particular interest in epilepsy or in MS or in cancer treatment or whatever particular field that they're interested in, and then they can recruit a number of patients that they'll be looking after. So I might take on 1,000 epileptic children, and therefore if each of them need £3 a year, I'll have a licence to grow 3,000 pounds of cannabis, and we just keep records on that. At that scale of growing, you can afford to have an HPLC machine and do things in a proper scientific way. Now, the third tier, and only the third tier, is pharmaceutical production. Everyone's familiar with GW Pharmaceuticals. They're a group in England that actually got started back in the 90s with the help of Prince Charles, who was actually approached by the MS Society members at some stage, and he actually pushed it through for them, so good on Prince Charles. But pharmaceutical production and prescription by doctors should only be one of the three possible methods. I am very much, and it's not only a question of sour grapes, but I'm very much opposed to a profession that spent 70 years opposing the medical use of cannabis, now having the only right to prescribe it. It's simply not right. Yeah. Okay. All right. Medical cannabis is only a small part of the cannabis story. We talk about revolution now. We talk about a hemp revolution. We talk about a transition from a hydrocarbon economy to a carbohydrate economy. These things are achievable. We're talking about not achieving our Kyoto Protocol targets, but exceeding them by multiples. This is possible, and unlike what the doomsayers, it won't involve a reduction in living standards. In fact, the widespread application of industrial hemp for the production of paper, for the production of hemp plastics, production of building materials, these things can be an economic engine to develop the country, a massive amount of import substitution, and a huge potential for quality job growth and export. We can do that. Okay, next one. No. Now, listen, what do you think of a country? When you do that to its old growth forest, that appears as a positive on the country's balance of payments. So if you chop, the economists that are running this world are morons, if not psychopaths. They say you go and chop down your old growth forest and then you put it in your ledger as something that's good. You've generated $200 million worth of timber exports to Japan, but you've also degraded your country, its life and its waters. So we're dealing with hoodoo economics, and they're not leading us to a brighter future. Okay, building materials. Hempcrete is an ideal building material. We've done our first little project here just to test the material. It is fantastic. It's like working in adult plasticine. Once you've decided to build something with hempcrete, any shape you want to do, any form of building you can do, it's brilliant, right? We're not even at the beginning of our learning curve with that, and we can do so many good things at once. See, people come to us for medicine, but then we're trying to intervene in a person's lifestyle on factors that we don't have much control over. So you give them some cannabis, but you send them back to their new house in their new car, outgassing all these volatile organic compounds, and then the house is just full of electromagnetic smog and things like that. There's only so much intervention you can do to have an effect without doing everything. And it really is a major step for people fighting cancer. They think they can take a bit of cannabis or make a few minor changes to their diet. To be successful in treating metastatic cancer involves almost a total mind-body application. Some people have done it, and hopefully as we develop the methodology, we'll become more successful than what we are. Okay, mate, next. Is everyone aware of the hemp car made by Henry Ford in 1941? Yeah, it was featured in a documentary $1 Billion Crop back in the 90s. There's Henry Ford smashing at this plastic car made in 1941. Why was that documentary buried? Not only was it buried, the American government took its index card out of the Library of Congress. We went over there in 1994. We were aware of it from Jack Herrera's email, and we went looking for it. So we were there with our film crew, and you could go through the cards. Now, let's say it was number 7. You go through 5, 6, 8. Where's number 7? We went to the librarian and said, where's number 7? He knew what we were there for. We had the cameras, we had the I Love Pot t-shirts and things like that. But he had no explanation, right? At one stage, the explanation was, oh, it had confused the kids. They might think pot is better than what it is. All right? Well, we better confuse our children, I think, if that's the case. All right, well, that's all I've got to say on the subject for now. And who wants the organisers, whether we have questions now or later?
We could do a couple of questions, I reckon.
Okay.
And then we're going to do a Q&A at the end.
We're going to have a break after this one too.
We'll have a break.
Yeah.
So a couple of questions, although I think we'll have a break after this. But Andrew will hang around outside if you've got a really personal issue. I'm sure he'll be around to talk to.
And also,
Stand up and
today's
speak up, I reckon.
favourite article, Michael. Today's Australian is Dr. Katelaris.
Thank you so much. I'm really grateful for that talk, Dr. Katelaris. I just have one question about one of the slides that you were going to come back to in the treatment of cancer, and you were talking specifically about the nutritional deficiencies and how omega-3, zinc, magnesium, and there was maybe one other one, those specific minerals and nutrients deficiencies in our kind of corporate diet that's out there, how those deficiencies relate to the endocannabinoid system and the treatment of cancer.
All right. That's a big question and a good question, and I can't give a definitive answer. The one where it's clear that I already highlighted, without having the right lipids going into your diet in the form of hemp seed and flax and chia and things like that, your cell membranes simply don't form in the right way that can be then used to produce the endocannabinoids, right? But there's much more to it. And in the body, it's a case of, no man's an island complete in itself. We're all part of the whole. I'll just divert a little bit. I mentioned selenium, for instance. Now, selenium, because this touches on supplements too, so I'm taking a bit of liberty with that question to bring up another point. There was an experiment. Selenium is a critical trace microelement that's used to make an enzyme called glutathione reductase. Glutathione is a major antioxidant in the body, the intrinsic antioxidant. So antioxidants can occur in the body or in the diet, and you need them both. Without selenium, you don't make glutathione, you don't have the intracellular antioxidants, and you're much more prone to cancer and other diseases. Now, they did an experiment in New Zealand last year where they took, I think, 20 to 50 people, and they put them on selenium tablets, which are an expensive way to take selenium. They put the others on 2 Brazil nuts a day. Now, Brazil nuts concentrate selenium, And at the end of 3 months, they measured the blood levels of selenium, and they found that in the tablet group and the Brazil nut group, the levels were more or less the same. But when they measured the amount of glutathione in the two groups, they found that the Brazil nut group had 3 times as much glutathione activity, right? So nutrition is incredibly complicated. It's not only the primary nutrient that you're after the minor cofactors as well. So I don't delude myself into thinking we have such a good grasp of human physiology that we understand the subtleties of how things work, and you can't improve on nature, right? An elemental diet made up in a chemist's laboratory can't be as good as fruit and vegetables. You might say, why not? But it's not. There are dozens of minor elements that interact together like an orchestra, right? So the function of the endocannabinoid system really depends on the functioning of all the systems. But the one key nutrient is the lipid intake and the imbalance of 3 and 6 and the over-intake of saturated fats.
Earlier you alluded to an amount for a cancer response.
Say again?
You alluded to an amount of cannabis or an amount of CBDs or an amount to get a cancer response. Like, what is that amount? That seems to be a magical number.
Yeah, no, the amount's not known. Look, there seems to be 2 very different ways of using cannabis in cancer. Right? Now, the usual one, the prior way, the Rick Simpson sort of thing, just load them up and they'll be okay, right? We've had a lot of trouble with Rick Simpson oil, I have to say, right? There's a lot of intolerance, a lot of inability to actually tolerate it. And the people have said to me, look, even if I die, it's better than going through that sort of thing again. That's not everyone's view, but there is a fair amount of intolerance. Now, what I'm increasingly doing now, because our primary intervention against cancer is dietary, and I'm increasingly using cannabis in a dose that's dictated by the patient's well-being. So they say, how much should I take? And I say, take the amount that best enhances your life. So we're using it as an indirect effect via the psychoimmunological connection between being happy and having a vibrant immune system. Now, having said that, in the test tube, there does appear to be a fair bit of evidence that there's a dose response. So say you've got cancer cells in there, you put in 5 micrograms, no response, 10, no response, 15, good response, 20, better response. There is a dose response, right? But whether we can translate the dose response in the test tube into the human body is another matter, right? What I've found, say for instance, and we're constantly confronted by people with ovarian cancer. Now, ovarian cancer is a very lethal form of cancer because it presents late, and they end up with metastases in the stomach or in the abdomen, which interferes with their digestion of food. So with those people, we're experimenting with the idea of actually introducing the cannabis by injection in a similar way. See, it's working so well for the BCCs because you get a very high local dose. Right? Very high local dose, and it's simply not possible to eat enough cannabis to get the sort of doses we're getting on the skin, right? I don't know my way around that, and it may be that it's just not a practical strategy, but we are preparing ourselves scientifically now for looking at injecting cannabinoids strategically in places to give very high local levels, okay, but it's still very early days on that. Does that answer your question? There's certain, well, I don't know about a saturation point, but I've seen people who, as their disease is getting out of control, they take the dose right up, and it does become negative. You can have too much oil. There's no doubt about that. And I think at the higher levels, it can even become immune suppressant. Right? And also lying around for 18 or 20 hours a day at a time is not conducive to regaining good health. Right? So, yeah, I'm struggling with sorting that out at the moment, but at the moment, we're actually moving more towards using patient-directed dosages where they're operating on their well-being as the endpoint rather than some idea of 1 gram a day as per the Simpson method. Yeah. Not an easy question to answer.
I reckon we'll have So have you seen yourself in the Good Weekend This is the Good Weekend magazine this weekend. II.part. Have you seen that?
No, I hadn't.
There you go.
I'll take it over to my mum.
So it's so nice to hear a doctor say, look, I'm not sure about that. We're still working that out. You never hear doctors say that. I love hearing that. So I reckon we should have a break. And then Chris Harris, a local healer, alchemist, is going to talk. Simo's made terrific and Narelle hemp seed food out there. And I think Andrew will hang around and you'll get a chance to talk to him out there. When the talks come back on, say in 15 minutes, we'll close that door though. So if you're outside, try and keep the noise down a bit. Make a donation out the front for Gail, the costs of everything, and really appreciate you all coming. Isn't he a hero?